believe that most of you would agree that change is sometimes not only difficult, but very painful. Based on that premise, I want to talk a bit about managing change. Managing change has a lot to do with not only understanding why there's a need for change, but also the political, the social, and the economic reality of what that entails. What my presentation is about to do is a number of very important aspects of not only change as we know it with the Patient Protection Affordable Care Act and healthcare reform, but also what it means for your institution. What it means is, number one, that you need to understand the law. In front of me is the law, a copy of the law, 955 pages. The important thing is to understand what is in that law and what it means to each of you in this room. Number two is to cut through the politics and the political rhetoric of what change is about. Our job is to look at this from the perspective of the provider and to understand what that means. Number three, to understand the key provisions of this law. Number four, to understand what it means to your institution in terms of the timetable that needs to be addressed as this law unfolds. And finally, to take a look at what that means relative to sustainability for your respective audience, your patients, and your institution. The topics that will be covered today under my presentation that relate to this, the Patient Protection and Affordable Care Act. Number one, accountable care organizations. A concept that's new by the law, but something each of you should understand and what it's about relative to this institution. Number two, patient-centered medical home. Again, a concept that's been around for years, but something that you should be familiar with relative to the management of care for your patients, especially for primary care physicians in this room. Bundle payment for the administrators and for the managers of this organization. What that means as far as payment and how you're going to manage the network of patients that are coming through your institutions. Paid for performance, both clinical and patient satisfaction metrics. And finally, an update, as timely update relative to the regulation and the management of those regulations as it unfolds in the law. What this presentation is not about. It's not a SWOT analysis. You can find that in the rhetoric going on in our nation today. What it is about is a micro-analysis of both the supply and the demand side of the law, as well as the implications of that law for this institution and this organization. Think of it as a sports analysis. We're going to help you understand in this presentation how to move the ball down the field, how to get in the game, and how to engage.
Professor Anderson, one of the questions we have from the audience has to do with if you could choose the three top factors in the Affordable Care Act that you think improves the delivery of health care going forward, what might those be?
Scott, that's a great question. I would say number one, patient-centered medical home. Number two, integrated care, because it clearly focuses on the integration of care for our facilities, institutions, and caregivers. And finally, better management of data information such as electronic medical record. Whether you agree or not agree with that as an outcome, this is what the focus of the Patient Protection Affordable Care Act is about.
Okay. Also, there was a question that was raised having to do with the fact that there's a significant amount of money that is spent at the federal government through the entitlements, and when you look at it, that it is primarily through Medicare and Medicaid, and of course a lot of that flows to hospitals and physicians. So what is your sense of, is this too big to fix or too big to fail?
Classic question. We hear it every day. We hear it not only from your institution's perspective, but also from around the country. There's no easy answer to this, Scott, and those in the audience. We have to look at this relative to what we are spending. We have to look at the demand for care as well as the suppliers of care, which are each of you in the room. The providers play a huge role in delivering that care, and the demand is only going to increase. We have an aging population, and we have an increase in number of people that are going to be insured. So there is no easy answer. What we have to understand is the nature of the question, and so that is how we proceed with looking at and how we address that in the future.
Well, let's talk a little bit about why hasn't it been fixed. We all agree that it's complicated. In fact, there are 10 times as many healthcare regulations as there are regulations in the tax code. We all agree that it's interconnected. I think at one time or another we've all used the analogy that you squeeze the balloon here and it pops out somewhere else. Certainly, many of these folks have dealt with the fact that there are high expectations out there, that many patients, they want their care now, they want it for free, and they want the best quality available. So what's your sense of how we move forward and address those issues?
Yes. We need to focus in on the here and the now in the short term. But to answer that question, you have to also understand the long view. We're in this through 2017. And so we have to keep our eye on 2013 and beyond. For example, if you look at the DRG payment and the 1% beginning in 2014 that is going to be held in order to create that incentive pool, that will only increase by 0.25% over the next number of years and out.
Well, thanks, Joe. I have to tell you, sometimes I feel like we're click and clack of the Tappet brothers, and we have a great ability to answer any question, whether we know the answer or not. So,
yeah, well, Scott, I have a question for you.
I was afraid of that.
Our country is so polarized, and those in Washington believe that it can be fixed.
Well, Joe, people tend to forget that we've always had strong beliefs in this country. If you go back to the founding of this country, even approving the Constitution was a very difficult process between the Federalists and the Anti-Federalists. And so that's part of our culture. And I actually think that if we at least can get some resolution, a constructive debate is helpful. Unfortunately, anymore the debate just is not constructive. I guess I would also make the observation that recently Senator Olympia Snowe, a Republican from Maine who served in the U.S. Senate for 18 years, she's retiring. She said she's a bit frustrated, but she does give us an important piece of advice. She says that the American people have to really weigh in and demonstrate that there is a political reward and incentive for working across party lines. And I know the partisans on each side of the aisle don't necessarily like to do that. At the end of the day, that's what makes good public policy.
Well, my final question is then, we the people have the opportunity in November to make a difference. Will that
true.
Make a difference? Will that send the message once and for all to Washington that we cannot put up with how we are polarized?
I think people have to carry that message to their legislators that they don't want a political debate, they want policy successes. They want to ask the question, does that particular policy make sense? Does it hold water? Does it help people in their communities? And that's the message they have to carry, and that they fully expect legislators at the state and federal level to work together to solve problems.
Now, we're going to hold you to this.
That's fine.